And so, Ziv, you talked a little bit about the central and peripheral nerve system, and we've established that nerves can cause pain, but how do we understand better what a migraine is and a headache and nerve pain? How does that all play into each other?
Yeah, so I think when you think, for me, I think of the three most common types of headaches people talk about are obviously tension headaches, migraine headaches, and cluster headaches. These can be thought of as sort of three circles, and each of them supposedly have their own sort of unique symptoms that differentiate one from the other. Tension headaches are, of course, usually mild or very moderate. They are the headaches that we all experience from time to time. They don't typically last a very long period of time. They're not that severe. They're usually very well treated with simple over-the-counter medications, such as Tylenol or some type of ibuprofen like Motrin or Advil or Aleve. And they tend to respond to very conservative modalities like rest and hydration, things like that. Migraines are a completely different entity in that they are a very serious neurologic condition that to this day does not remain very well understood or completely understood. We know a lot more these days than we did in the past about migraines, but there remain a lot of different theories as what causes them. For example, neurons kind of firing abnormally inside the brain, like epilepsy, but perhaps without the seizure activity, blood vessels that are dilated or expanded when they should be constricted, or certain chemicals that are off balance, for example, serotonin, hence the triptan set of drugs or class of drugs that was first popularized in the late 80s and 90s. And then, of course, there are cluster headaches, which are very similar in a lot of their presentations, but they tend to occur in clusters, and then you have a relatively pain-free period. When we think about these kinds of headaches, the difficulty that I think we run into very often in terms of clinicians who are trying to diagnose one versus another is that while we'd like to think that, yes, there is that central area where all three circles overlap, that central area should be a small subset of patients where it's more difficult to discern if you have migraines, tension, or cluster headaches. But the reality is, if you go to, I think it's the next slide, so many of the symptoms for so many of these types of headaches overlap so commonly that the ability to distinguish them is actually pretty small. And so we often have a very small subset of patients that you can very easily distinguish as migraines versus clusters versus tension headaches, because a lot of these symptoms are very similar in all three groups. When we think about nerves, as you've just described them, Lisa, we really think about neuralgia as a completely different entity. In other words, in this case, you actually have a mechanical problem, something that is pressing on or irritating a nerve. For example, an enlarged lymph node, an enlarged blood vessel, a spastic piece of muscle that is squeezing a nerve as the nerve passes through it. And so when you look at a different way to think about these headaches from a figurative standpoint, and you think about neuralgia, you can actually have neuralgia or nerve pain that is similar in presentation with elements of all of these types of headaches. And when we think about them, we kind of go back to that first image, but we have three different areas of neuralgia that really can present or be confused with migraines or with tension headaches, usually more severe versions of them, or even with cluster headaches.